The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Sedation dentistry is today's topic. It's a big topic. According to my first guest, 90 million Americans are afraid of the dentist, and they don't go because of it. Thousands, tens of thousands in San Diego are walking around without smiling because of their smile and their fear of the dentist. With us, we have San Diego's very well known as a cosmetic dentist, but also a sedation dentist, Dr. Briscoe. Dr. Briscoe, welcome to the program.
Thanks, Randy. Good to be here.
And always a pleasure to have you on the show. Interviewed you about cosmetic stuff, really good. Your photos are good. For people that don't know you, we'll start there. Tell us a little bit about your practice. What are the procedures you do? Who's the typical patient?
Well, we don't really have a typical patient. We have CEOs of companies. We have housewives. We have college professors. We have students. We have young adults. We have retired individuals. We have people that show up regularly on time. We have patients that show up every 5, 10, 15 years. So we have a wide variety of patients.
And, you know, I got that statistic from you. 90 million people are afraid of the dentist.
That's right.
So who does a survey like this? Gallup or something?
Well, NIH, the National Institute of Health, reported that half of America doesn't see a dentist.
They don't see one at all?
They don't see one at all, and they list fear as the #1 reason.
And what are they afraid of, by the way? Just the pain of it?
I think they're afraid of the pain. They're afraid of getting hurt. They're afraid of the needle.
Yeah.
So sedation dentistry works well for them. They can take some pills, we can get them comfortable, relaxed, then we can get them numb, and we can do our procedures. And they don't have any recollection of the procedure. They wake up,
right?
They go home, the next day they're good to go.
So I guess there's two types of patients. There's the highly anxious, and then there are those people that are just so busy they could come in and get sedated, and you could do multiple procedures at once?
Yes.
Tell me about that.
Actually, there's a variety of types of patients, but those are two big ones. We have the lay awake at night, gut-wrenching, palm sweating.
Really?
Fear of the dentist, just totally.
You're kidding me.
No,
like knowing they have to go to the dentist,
they just can't sleep. So for those types of patients, sedation works beautifully.
I've never heard of that before. Go ahead, keep going.
Let me show you a picture. This is a patient that came in. He hadn't been in for 25 years. Shows up, wants to get his mouth healthy. Things kept sliding on him. Tooth chips here, crown falls out there. So sooner or later, he has to come in. Shows up, we have a delightful conversation. He's nervous as anything.
I mean, he's really totally nervous in front of you. You could tell.
He is. He had a nervous humor, great sense of humor, but it was a nervous sense of humor. So he sits down, tells me a story. He just had some bad experiences in the past and did not want to repeat those. So he kept putting off and putting off until finally he couldn't put it off any longer. So he comes in, he wants to get his mouth healthy, wants his bite to work right, and he wants his teeth to look great, and he doesn't want to come back for another 25 years.
Is that what he said?
That's what he said. Now,
yeah, I don't blame him.
We're convincing him that he can't stay away that long, but we gave him his options. He decided, let's do sedation dentistry. We did 4 visits of sedation dentistry, restored his whole mouth, including cleanings, gum therapy, and he's back in shape.
So he went from that.
He went from this, not a great smile. The dentists of the past did their best, but you know, when the guy's anxious, they're moving around, they're herky-jerky, you can't get in and do much. So he has what he has. He stepped up, did his sedation, and we were able to restore his mouth to...
Now that is very nice, by the way. I mean, when you look at the difference between that before and that after, you know, in the after, he looks like $1 million.
Yeah, he looks, it's a nice shade. He looks about 10 years younger than he actually is. Funny story, my son and I were at the ball game. We ran into him. He's a season ticket holder with the Padres. So we saw him in the concession area. He invited us to come down, sit in his seats with him.
Okay.
He knows all of the guys in the area, so he was sitting there the whole game entertaining us, but talking to all of his friends. And I paid attention to the game half and paid attention to Bob's smile. He just kept talking and laughing and having a good time. he feels very good about what we've accomplished
So
for him.
that's interesting. Okay, so you're at the game, but you can't help but admire your work.
Exactly.
Is that right? I like that story.
He just kept smiling. He kept telling jokes. He kept people.
And he wasn't like
entertained.
that before.
I didn't really know him before, so I don't know. But
Okay.
he didn't have a pleasant smile, so it wasn't something you would notice on
So
him.
was he just like a person that just didn't like going to the dentist?
Yeah, bad experiences of the past, and he didn't want to relive those.
Is it the pain they were worried about more than, or just the fact that, like gag reflex? What is it?
With him, it was pain. He had situation in the dental office that didn't work out well, and he didn't want to wind up in the same situation.
Because nowadays, it's virtually painless. I mean, you don't feel the procedures anymore, right? I mean, for the most part,
you don't. But people that have had tough times in the past, that's what they remember. They don't know today's dentistry because they hadn't been in.
So it's been 20 years. Now, a guy like this, okay, now he looks like a guy that has fantastic teeth, a lot of health. Do they get the dental bug where they now want to come in 6 months? But he said he didn't want to come in for another 25 years.
We've coaxed him back. He comes in for cleanings. So everything's done, so all we have to do is maintain. And we work with him to do what he needs to do at home every night.
Some people probably fall asleep during the procedure.
They do.
You got to keep them awake though, right?
Yes, although, at certain times them being asleep is fine. But we keep them so that they can respond to commands.
Okay. Now the highly anxious patient, the people that haven't been in 20 years, okay, their mouth is a disaster, okay? Do they feel like they're going to get a guilt trip when they go to the dentist, or that you guys are going to scold them? I mean, what do they tell you? What's kept them away so long?
I think that's the conception many people have, that they're going to come in and get lectured about this, that, and the other. We're not sitting there to judge them. We're there to help them, give them their options, let them know what's available these days. Unlike 20 years ago, there are more modern techniques. And so we make them feel comfortable, give them their options, and listen to what they have to say, and then decide how we want to proceed.
Now, the people that come to you, we've talked a lot about this off camera, that on the consult they say, "Doctor, you've probably never seen anything this bad in your life."
That's what Bob said.
Really?
And I kind of chuckled. I said, "Bob, we have a good number of patients in our practice that started out just like you, and we've gotten them fixed up." And we showed him pictures of some of those patients.
So with him, these are veneers you gave him?
These are veneers all across the front, top and bottom, crowns going into the back, replacing some of the old dentistry that he had.
What about people that think you also say they think they're too far gone, that there's nothing you can do?
We haven't run across too many people that really are too far gone. We've got a lot of people that have that thought. But,
okay.
But you get in there, you explain to them what can be done, you show them pictures, you show them their teeth, show them where they can be. Usually we can get to the point they want to be.
And do people travel distances to see you?
We have patients from other parts of the county. We have patients from other states. We have a few patients that come in internationally and see us.
Now the pill that you give them, so that they have to have somebody drive them home?
They do. And the way we like to do the sedation is we actually give them a prescription for some medication the night before so they can sleep. We want them well rested when they get there.
So even the night before, by the way, but the night before, are some people sedated the night before because they can't sleep?
Absolutely.
Is that right?
Well, these are the people that...
I'm amazed that they're that afraid of the dentist.
I was too when I was in school. I've always had good experiences as a patient. I didn't realize that there was this whole group of people out there that just couldn't handle coming in to see the dentist.
Are there spouses that bring in their partners, literally have to drag their partners into the dentist because...
No, by the time we've gotten to the point of the sedation appointment, they're resigning themselves that this is where we're going, this is what we're going to do.
The smile. Okay, so there's people in San Diego, we start at the top of the show, that don't ever go to the dentist. Okay, so somebody watching this, they haven't been to the dentist in 5 years, 10 years. What do you say to them about making a decision about their smile? And let's say that they don't like their smile either, on top of it.
I can't figure out why anybody would live with a smile that they don't like when there's options available to them, whether it's simple whitening or something more complex, veneers. So we sit them down, listen to what they have to say. once we get past the fear factor, then we can hear what they want to talk about. We put their photos up on the monitor. They can evaluate them with us, and we can show them pictures of patients like them that have had treatment and the outcome that they have. We're happy to put these patients in touch with some of our existing patients that have had treatment done, so they can here's what they did for me.
Do you like this highly anxious patient? Because I talk to dentists and they don't like that patient.
I think
behind the scenes, they say, Randy, it's tough to work on these patients.
They're wonderful patients. Once we can decide what it is we want to do, we start sedation, they're actually easy to work on because they're comfortable, they're relaxed. We can get in and do our procedures, and when we finish, we can send them home. They have a nice night's sleep. They wake up, their mouth feels totally better.
How important is a smile in this economy or any economy?
I think it's your personal calling card. It's the first thing people see when they meet you.
Okay.
And when you're conversing with people, they're either looking at your eyes or they're looking at your smile. So half the time, your smile's center stage. So I think it's extremely important. People that feel good about their smile are going to smile more, they're going to laugh more, they're more self-confident, they're easier to be around because they're so outgoing. They're more successful typically, professionally, as well as in personal relationships.
I read that, I was looking in the internet about this and knowing you were going to come here today, but they're saying that a lot of the very successful people, the type A personality, a little bit of ADD, they don't want to lose control. They don't want to be there while you're working on their mouth. So these people don't go to the dentist. What are your thoughts on that?
They're busy. They're the star of their own show. So when they come in to see us, they're a little reluctant to give up control. But if they want it bad enough, we let them know we can accomplish what they want in the time frame they want it done, and they can have a beautiful smile. This gentleman came in. He's a CEO of a company.
Okay.
Doesn't have a CEO
Doesn't
smile.
look like a CEO.
No. So
okay.
He never liked to smile. He'd lived with that forever. His wife prompted him to come in. She had gorgeous natural teeth. She had done some whitening. So he came in. He didn't want to hear what it was we had to say. He told us what he wanted. We did our exam. We wanted to talk to him further. He said, no, this is what I want.
What did he say? What did he say?
He said, I want my front teeth to look like $1 million, and I want it done in a hurry. So he
didn't want to hear. He said, look, you guys don't have to tell me anything.
No, he knew what he wanted, and that's what he wanted. He set the course, so fine. We set him up for an appointment, had him in, did his sedation, created a beautiful smile for him, and
let's take a look at that. Very nice. So, he looks happier.
He looks happy. He's feeling the veneers with his tongue. Smile line follows the lower lip line. The teeth are brought forward so they're more prominent, so it looks like he has teeth, and he smiles more now.
And veneers don't stain, is that right?
That's correct.
So you don't even have to brush them. Well, if they don't stain.
We don't want to give the audience the wrong idea. Absolutely.
Okay.
You do need to brush, you do need to floss, but no, they won't stain like natural teeth will.
And they last a long time? I mean, they should last like regular teeth?
They'll last a long time. My answer to that really is, how often do you want to come in and help us take care of them, and how much are you going to do at home? So patients will typically brush and floss their front teeth before they brush and floss their back teeth. Interesting story about this gentleman. Finished his front teeth, his veneers, and then he said, okay, what else do I need to have done?
Okay.
So then once we had accomplished what he wanted, he was willing to listen to what should be done. So we went ahead then and accomplished the rest of his dentistry. He then went on, at his wife's urging, and got some hair transplants. So that the top of his head was a little bushier than it was getting to be. So,
it's like a complete transformation, though.
Absolutely.
That is very interesting. You take care of one thing, it may give you leverage to do something else.
Exactly. And we have plastic surgeons that have sent patients in to see us. Patient comes in thinking about a facelift, and it's like, well, you need to get your smile first, because that's really, in my eyes at least, more important than the facelift. So they come over and see us, and we get the smile done, and then let them go back and evaluate whether they want to do the facelift.
I spoke to a guy from Extreme Makeover, the ABC show, and they said, Randy, of all the things they did on the patients, the smile made the biggest appearance change?
Your smile's right there in the middle of your face. You have some nice white teeth that are lined up beautifully. It's a gorgeous smile. So
the fear of public speaking, I think they say, is almost like number one. But fear of the dentist has got to be in the top 5.
you would think.
And
half of America doesn't go to the dentist.
just because of that fear. So what do you have to say, and we're going to take a quick break, but all of the procedures you do can be done while they're sedated.
Absolutely.
And which do you prefer, by the way? I mean, the nitrous, the oral sedation with a pill. I mean, is one better than the other, or it depends on the procedure?
It depends on the procedure. It depends on the patient. The nitrous, you can turn it on and turn it off.
I like that stuff.
The patients can walk out, drive home, so they don't need to depend on anyone to transport them.
It's not really expensive to get that done.
No, nitrous isn't. Even the sedation isn't really that expensive. The sedation works for the patients that just can't relax.
I think everybody should do it. I mean, really, if you're going to go in there and if you're going to have a 1-hour procedure, it seems like you might as well do it.
The nitrous works well. If you need, there are other. We talked about the patients that are very fearful of the dentist. We talked about the CEOs that come in and want it done yesterday. There are people that have tremendous gag reflexes that just can't. You can't put anything in their mouth. We have a patient we saw recently. You can't even recline the chair back very far because he is uncomfortable in those positions. I don't know how he brushes his teeth, but
really, that big of a gag reflex?
That big of a gag reflex. We had done some nice cosmetic dentistry on his wife, and he decided, I want to get in on that. So I want that. And we sat down and talked, and the only way we could possibly do it was to sedate him fully.
Okay.
Otherwise, he was going to be jumping around. We were going to have to be standing straight up to treat him. We sedated him. He's a whole different patient. We can recline the chair all the way back. His body totally relaxed. The gag reflex disappeared, and we're able to get in there, do 10 veneers on him, make him look like $1 million. When he woke up, he loved his smile, and those were only the temporaries. We typically have them back the next day so that we can evaluate with them fully aware of things. Had him back then the second time, sedated him again, delivered his veneers, and he just loves them. Can't stop talking about it.
Now, this seems like an obvious one, but I mean, are patients, are these patients also surprised or not even aware that this exists, that sedation dentistry exists?
I think more and more patients are becoming aware of it. Although they've heard bits and pieces, they're not really sure what it is. Are they going to totally knock me out? Or are we going to do it in the hospital? So we sit down and have discussions with them about really what's involved and how simple it is, how easy it is, how quick we can actually do things, and the number of visits it takes is condensed way down.
And after it's done, okay, so you've improved their smile. They have this beautiful smile. Does it get them now where their brain goes, that was a good experience, where they now start taking better care of their teeth and they're in there all the time every 6 months?
They are. They're in there much more frequently getting their teeth cleaned. And this last patient we were talking about, he's starting to notice, I have gold crown on my back that I don't like, and I have a silver filling over here. So he's thinking about, okay, next time we do some sedation, I want to get those restorations out of there and get some nice white ones back in there.
So metal-free dentistry, whatever. What about just a cleaning? I mean, some people that are highly anxious, they could request this nitrous, this gas, even for a cleaning.
And we do. We have a group of patients that's the way they want to be treated every time they come in.
It's a luxury, as you say.
It is a luxury because they can come in and relax, enjoy the whole time they're there. They can watch a movie, listen to music, go off into La La Land, and when we're done, turn on the oxygen and they're back in business. They can drive themselves home, back to work, wherever.
Well, good. We're going to take a quick break. We come back, more about other procedures you could do while being sedated. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Briscoe, San Diego's sedation dentist. We'll be right back. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, sedation dentistry and what you need to know. And if you're afraid, if your fear of the dentist has kept you from the dentist, then you got to hear what Dr. Briscoe has to say. He's San Diego's sedation dentist. Okay, so you're back. Very interesting stuff. I'm so surprised, I have to tell you. that so many people are afraid of this. But what are the categories of sedation dentistry patients you see?
Well, we talked about the patients that are terrified. We talked about the busy CEOs. We talked about the gaggers. Another one is people that have just put things off and put it off, and all of a sudden they have a long list of things that need to be done. A filling falls out here, a tooth chips here, crown falls off the back tooth, their gums bleed over here, they have sensitivity up here. All of a sudden they have a list so long, it's overwhelming. I'd be overwhelmed if I were the patient.
Okay.
So the best thing to do, we sedate them. We can accomplish most, if not all of that, in a visit or two.
So they could be there like 4 hours?
They can be there 4 hours. Sometimes we have them there longer.
8 hours?
6 to 8 hours. But we get the dentistry done so that when they wake up, they're in good shape. Their bite's better. Their smile looks better. Their teeth are clean. Their breath is fresh.
And the longer they wait, it's obviously more expensive. The longer they wait. It means if you keep putting it off and keep putting it off,
then you wind up with things going
More
from
things
simple
done.
fillings to crowns, potentially to root canals, extractions, implants. So yes, the longer you wait, the sedation itself doesn't get more expensive, but the procedures that need to be done to bring you back to optimum health become greater and greater.
Now your office, you told me you feel like your office is a little bit different than others. I mean, as far as staffing and everything. How so?
We have a wonderful staff. We're all focused on creating a total positive patient experience for each one of these individuals, whether they're sedation patients or whether they're not. And that's just our commitment to the community, is to be better than other offices that they've seen, so that we don't bring back memories of what they've had in the past, the smells, the sights.
The patients tell you you're different? I mean, do they tell you that you're different? Do they say, this is not, I've never been to a dental office like this?
Occasionally a patient will mention to me, doctor, you have a wonderful staff with a special approach to dentistry. And that makes me feel good, because all that we go through to try to create a positive experience for each one of these people comes out, and I'm reminded of that then by the patients.
So do you want to be known as the sedation dentist in San Diego? I mean, the go-to guy?
I love the sedation patients. The patients I've described actually are mainly male. I'd love to see more females come in, because they're about half the population, and if half the population isn't coming in.
Interesting. So it's the guys that are afraid of the dentist.
More guys than will admit it.
Is that right? And so you say 90 million people are afraid of this. So even simple things as whitening or even bleaching or a cleaning, just to get started, they can be sedated.
They can be sedated, nitrous oxide, or the oral conscious sedation. Some of the procedures aren't that involved, but remember, Randy, you and I are comfortable with the dentist, or at least I am.
Yeah, well, now that I never have been, I told you that, but once I found out about this nitrous, because I gag, it's the best thing ever. I mean, literally, I've been telling everybody, if you've done this nitrous, when you're there, it is just completely relaxing.
Exactly. So
I mean, it's nice, really. And even afterwards, you're not stressed out.
No,
It is like a spa day, like the way you feel after a massage. It's very relaxing.
Right. As more patients realize that, then we'll start to see more of these patients coming in, because they need the dentistry. They just keep letting things pile up on them as far as sensitivities, broken teeth. Let's get in and get them fixed now.
So you handle, you're training. I know you went to this Pankey Institute. I guess doctors all over the country, and also Las Vegas Institute, doctors from all over the country. You understand bite and TMJ situations. You could handle pretty big cases.
We can. One of the categories we do, which we haven't talked about, is functional dentistry that's beautiful. And people that have worn, broken down teeth, their teeth used to be this long, and now they're this long, and they're this wide, so they're square looking teeth. You can bleach those all day, they don't look good. So what we do is get the bite lined up with the joint, reestablish a healthy vertical, and we can...
So functional dentistry, you call it.
Functional dentistry that's beautiful. So we reestablish a proper vertical, and then we can start building teeth up front that won't wear down, won't chip, won't break. And we can create a natural length to them that they haven't had in years. The teeth started out that way, but they...
So if you have short teeth that are shrinking, it's because of a bite problem, is what you're saying?
Typically it is because of a bite problem.
And you could fix that?
We can fix that. Line up their teeth with the joint to strike each other properly, and then we can start building front teeth.
So you have to have a special license to do sedation dentistry?
In the state of California, you do.
So not every dentist does sedation dentistry?
No, they don't. It requires special training and special license to do that. And your staff has to be trained also to do it.
In sedation, okay.
In sedation.
So take home message here. Okay, so somebody's watching this, they don't like their smile, but they also hate their dentist. They hate any dentist. They're just afraid of it. What do you say?
Come on in, let us evaluate you. We're not going to scold you, not going to judge you. Simply evaluate, take the opportunity.
So you have people, I mean, if they haven't been to the dentist in 25 years, it's okay, because you've seen it before.
We've seen it before, and we've treated it before, and we've been successful. And we have patients that you can talk to that'll support that.
Are there people ashamed? I mean, successful people that come in and say, oh boy, they feel really bad about it?
They do. They're apologizing before they even open their mouth.
Is that right? Like what?
And I feel terrible for that, because you don't have to apologize to us about your mouth. We're here to help you make some decisions on how you want to proceed. We're not here to scold you or make you feel bad.
Is this the happiest group of patients, maybe the sedation dentistry patients?
I think it is, because they realize that there's light at the end of the tunnel, that we can take their mouth, make it healthy again, make it functional again, and create a beautiful smile, if that's what they're inclined to do.
Great. Well, I want to thank you for coming on the show. Very interesting. Very interesting. Good stuff. Good photos. Now, and you have a lot of photos on your website.
We do.
Because you are known, we should mention, creating natural smiles. Beautiful smiles.
We have some wonderful patients. Not all of them let us put full faces on, but we have smile photos of them.
All right. All right. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go on our website at wellnesshour.com. Just put in Dr. Briscoe or Sedation Dentistry San Diego, and you'll be able to see it again or direct a friend to it. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.